Ayurveda Amritam. Hey Lord Agni, who is knowledge yourself and who enlightens the world, guide us. This fire, which has been lit in the pureness of morning, is the vigor and soul of a whole day. When it graces this atmosphere, it works as a medicine which purifies the environment. It also becomes a savior for many people with disease conditions and a blessing over the treatment skills. And thus starts a good day at Sreekrishna Ayurveda Chikitsa Kendram. As this land is worshipped daily with proper fire ritual Agnihotra, even the breeze here has a power to heal diseases. This Ayurveda treatment center for the healing of acute and chronic diseases is situated near the Shiva temple at Thiruvelikunnu, which is near Vaikam town, Kottayam district, Kerala, God's own country, the southern part of India. You can reach this place by travelling 72 kilometers from Cochin International Airport by road. Sreekrishna Hospital sits serenely in the middle of greenery like a hermitage. It's built in the model of a Kerala traditional Nalugata style, which gives the hospital a complete homely feeling. The flowers, plants, ponds and the streams here are really attractive. The whole setting contributes to healing in a big way. Ayurveda has been propagated through generations by the manuscripts written by sages. This institution stands for the practice of Ayurveda without losing its age-old values, tradition and purity. It is the mission of Sreekrishna as envisioned by the founder and chief physician, Dr. Vijith. Dr. Vijith completed his degree in Ayurvedic medicine from Rajiv Gandhi University of Health Sciences, Bangalore, and got practical experience from the famous Poondotam Ayurveda Ashram in Palakkad, Kerala. He is also doing research in the traditional Ayurvedic practices of Kerala in the Research Center of Ayurveda Pharmacy in Coimbatore. He also studied the authentic ancient script called Ashtanga Hridayam in traditional face-to-face method from his guru, the famous Ayurveda Acharya, Sri Vallur Manekal Shankaran Nambudiripada. Dr. Vijith is not only famous in India, but also throughout the world. He is one among the 4 faculty members from India to teach the study program Postgraduate Diploma in Ayurveda for Western medical practitioners at the Seva Academy, Munich, Germany. He is the leading member of faculty and a member of the curriculum board in Academy of Ayurvedic Studies in Amsterdam, Netherlands. He has a big group of students all over the world. Many Western doctors rely on this institution to know about the infinite opportunities and benefits of Ayurveda. What makes Sreekrishna Ayurveda Chikitsa Kendram so special?
This is an institution which was started by me, a Vaidya, a physician who studied Ayurveda under a guru, a teacher, to live through the guiding principles of Ayurveda and to propagate it. This is what makes Sri Krishna very special. This was asked as a Guru Dakshina, a tribute to my teacher, and I am passionate about what I do for others.
So, it is not for a monetary benefit, isn't it?
No, it is a worship for me. Treatment itself is a worship. Human life is the greatest expression of God Himself, and treatment is a worship. It is like the fire ceremony Agnihotra, which is performed here every morning. There is a fire inside our body too. like a digestive fire, or a carminative fire, or a metabolic fire. It is like putting havis, the substance offered to fire, for the fire. Each drop of oil, each drop of decoction, each drop of ghee, etc., which is medical, are offered to this Agni as havis. There will be a long, detailed consultation in the beginning and end of your stay to study your life in detail, to suggest changes at the end. There will be a detailed assessment of every individual patient, their lifestyle, disease conditions, history, environment they live, and its impact, etc., at the beginning of the consultation. A treatment plan suitable for the individual will be discussed and tailored to meet the specific needs of each individual. A doctor, Vidya himself, consults the progress of treatments with each patient in an ongoing basis and makes any changes to the treatment plan accordingly. There will be another detailed consultation planning for life after discharge, including the necessary changes in lifestyle, food habits. So rather than just looking at the presenting symptoms, Sreekrishna looks at a larger picture and tries to make a positive change in the lives of every patient. We prepare medicines for our patients in our own pharmacy in the campus. Nowadays, due to the commercialization, the quality of Ayurvedic medicines have deteriorated drastically. That is the reason why we manufacture quality medicines in our pharmacy itself.
Oh yes, we can notice that the quality of medicines which was there in the olden days is not seen in medicines available in the markets nowadays, isn't it?
Yes, that's true. In some cases, we have to prepare some unique medical formulations to treat some difficult diseases. This is possible only because we have our own pharmacy. Our main focus is the best treatment for the disease, considering the unique individual aspects of each patient. Here, we give a daily regimen for each patient according to their disease and individual constitution. The regimen from morning to night, do's and don'ts, according to their disease, is advised specifically. Many diseases which cannot be treated by other branches of medicine like allopathy or Western medicine are treated here using Ayurveda. Some prime examples would be diabetes, rheumatoid arthritis, and other rheumatic diseases. There will be several cases deemed incurable by some famous medical colleges around our region that got treated and completely cured here. Ayurveda has the power to cure many so-called incurable diseases. This is not a wellness center. A lot of patients from several parts of the world come here for treatment of many chronic diseases. By seeing a lot of Westerners from different parts of the world, many local people have misunderstood this as a wellness center. This is a center which purely concentrates on the curative aspect of Ayurveda. Sreekrishna focuses on research and revitalization of Ayurveda through the best use of ancient scientific methods. That is what makes this center so special.
Within a short time, this institution has got much publicity with its effective treatments. Focus on the purity of Ayurveda, individualized care, and the peaceful atmosphere are the specialty of this institution. The testimonials from some of the patients would prove it.
So my name is Miriam. I'm from Holland. I arrived 4 weeks ago in the Sreekrishna clinic. My main complaints were that I have heavy pain in my lower back, my legs and my hips. I was on morphine and on Parkinson medication for about a year. Yeah, I could not sleep anymore, and I couldn't do my daily things just because of the pain. When I arrived here, I had to continue with my medication the first week. We were building it off, and that was quite scary because I was so used to the morphine, and I totally couldn't sleep without the morphine. So, but Dr. Vijith guided me really good with that. So we lowered the morphine and the Parkinson medication, and I got some Ayurvedic herbs instead of it. My observations were that I had a lot of faith in the doctor, because otherwise I could not handle this at all. And the way they did it with the treatments and with the herbs I got here, it went in a very slowly way. It went really slowly. It was not from one day to the other day that I had to stop my morphine. So in the beginning, during the treatments, my legs were really shaking all over. So I totally could not relax my body. And I also, because of this cramping, I also had pain. So in the beginning that was really difficult also for me to just lay there and get treatments without me couldn't be really relaxed. I think in the second week when I was here, I think I felt that the pain got less, and that the herbs really did their work. So my sleep got better, and my body was slowly also more relaxed during the treatments. Slowly my body got more relaxed, and in the last more than a week, I could even lay on the table without shaking and moving and having all these cramps, and I was just laying and I could just receive the massages in a relaxed way for me. I think the program was really building up to get all the vata, because I had a very big vata disturbance and my mind was also involved with it. Yeah, I think that they were really working with the bastis in the end, that a lot of vata came out, really. I had a lot of bastis, and the last basti was a big one, and it was a cleansing one with special herbs, and it took 4 hours, but it was a big vata release for my system, and now today I'm going home, but I have no pain in my legs, I have no cramps, I have no movements that I have to make. It's just all under control, and my hips, my back. I feel very good. I'm really happy. Yeah, much more calmness. Dr. Vijith also really guide me with that. That also with the fire ceremonies in the morning that are really helpful, and he also explained in very clear language that how the mind works and what the impact of my mind is for my body. For the first 2 months, I have some herbs to take at home, and he gave me some pranayama exercises and some advices for nutrition, for lifestyle. Some advices what to do and what not to do. Like I wanted to go for swimming, but because of my constitution and the climate in Holland, he told me that was not such a good idea. So more things like that, really practical. Some advices what would happen if some pain comes back again, that I don't have to fear for it. Really good advices, what was really helpful. I'm really, really happy, yes. I could never imagine something like this could happen, because in Holland I was already waiting for an operation that they wanted to stabilize my whole lower back. So I needed to go for a big surgery, but now, now I don't have to go. So I'm really happy with that.
My name is Ankie den Hertog, and I'm coming from the Netherlands. Since 3 years I'm suffering from a hernia and a stenosis, and that leads me to a pain in my back and a radiation pain in both legs. But what is worse is my limping of my right leg. That hurts me terrible, so I cannot do much with my legs at this moment. In Holland I have several treatments, and that was acupuncture, osteopathic, manual therapy, and at last, the 14th of August, I had an operation at my back. But unfortunately, it did not do any good for me. My limping is not gone, the pain was not gone, nothing was gone. I came to Dr Vijith, I met him in Holland, and I gave it a chance, and I go to 5 op at the Sreekrishna Academy. I had several massages and several bandages, good Ayurvedic food, rest, and so on. And now I am 3 weeks further. My backache is gone. The pain in my legs diminished. Unfortunately, my limping is there, but less. And that makes me now very happy for the moment. Next week I go home, and then I take with me from Dr. Vidya some medication, some diet advices, and so on. And with that treatment, I hope that my aches in the leg go on to diminish, and that my limping is going better.
Similarly, for many other people, this institution has become a shelter and savior for life. It has guided many others back to normal life. This is an era which has lots of importance and publicity for Ayurveda. In that context, what's your view about Ayurveda, Doctor?
The culture of Vedas is one of the most ancient cultures of the world. I mean, the Vedic culture. We cannot forget that Ayurveda is an integral part of these Vedas, the Vedic culture. If we separate it as a rational science, maybe it will lose its actual essence. The word Ayurveda is derived from 2 Sanskrit words, Ayu and Veda. Ayus is defined as a phenomena in which the body, senses, mind and soul combine and stay together. Veda means knowledge, or to be precise, an experiential knowledge. So, it is the knowledge which tries to understand such a combined state. When a patient comes to us, we not only try to understand their body, but also his mind, senses, and soul. At which stage the patient is, what is the actual cause of his disease? The mind, body, senses, or the soul. Where is this disease located actually? So, when we understand a patient and look at a larger scenario, then only it becomes Ayurveda. Ayurveda is not only a treating science, but also a complete guidance for life. That is why the following statement exists about the benefit of Ayurveda. Swasthasya swasthya rakshanam, which means maintaining the health of a healthy man.
Keeping a healthy man healthy.
Yeah, this is the first motto. The next is Aturasya Vikara Prasamanam. This means, because of any reason, if a person becomes ill, then help him from that illness. It's a complete life guidance, a way of life. As a part of it, when disease occurs, treating it. To understand a patient and his disease like this is the importance of Ayurveda in the day. It is when we practice Ayurveda like this, we are able to get all the benefits of Ayurveda, which is recognized as the oldest holistic medicine system and recognized as a natural medical system. We understand a patient's mind and realize their problems, try to solve it scientifically, try to understand their mind and senses. This is the ultimate effectiveness of Ayurveda. Thus, Ayurveda tries to understand a person as a part of this universe, as a part of the environment. Ayurveda tries to understand where a person stands in this universal spectrum, why he became ill or why he remains healthy. We try to understand these things. It is a way of thinking and it's a way of living as well.
What all diseases are treated in your treatment center, doctor?
We have mainly 4 treatment departments. The first one is Chikitsa department. According to modern views, it is like the general medicine, treating the diseases which affects all parts of the body. The second one is Chikitsa, a department which treats patients in cases like snake bites, spider poisoning, or other poison-related conditions. These 2 departments mainly work under me. Then we have a Sreeroga department. This is a department which deals with menstrual disorders and diseases of pregnant women. We can call it as gynecology and obstetrics in Ayurveda. My wife, Dr Vidya Vijith, is in charge of this department, and there is one other junior doctor, Dr Marina Joseph, also works here. We have another department called as Marma Chikitsa department, which mainly treats joint diseases, chronic pains and injuries. This department is under Sri Baiju Gurukal, who is the teacher in Jayashankar Kalari in Kottayam.
To lead a healthy life has always been a human dream. Sreekrishna Ayurveda Chikitsa Kendram is unique in the fact that it's able to help people fulfill this dream to lead a healthy life. It opens the door to the infinite opportunities of Ayurveda. As you are treating the diseases affecting women, what are the main complaints of patients who come here? More often, we see cases like menstrual disorders and menopausal disorders. When we say menstrual disorders, girls usually come for getting treatments for dysmenorrhea, vomiting during menstruation, etc. So, doctor, is there treatment for such vomiting? Yes, it's there. The main reason for such discomforts is the lifestyle we have nowadays. Nowadays, people eat more fast food and many are careless about eating habits. One of the consequences is that it causes formation of gas, and it is a main cause of pain and other issues during menstruation too. The main treatment is maintaining healthy food habits itself, and then there are some Ayurvedic medicines one can take. These medicines helps to do a purification from inside. What are the problems, doctor, women have other than menstrual disorders? Due to menopause, women may get joint diseases. Another problem which is seen in women commonly is back pain. Is there a treatment for that? Yes, definitely. That is also mostly related to uterus-related disorders. It may start after the delivery of baby. It is mostly due to the lack of proper care after delivery. It is said that 1.5 months a Sudika, that is one who has delivered a child, must take rest and take care of her food habits and take the appropriate medicines. Our culture traditionally suggests such a regimen and lifestyle for every woman after the delivery of a baby. When mentioned this, in foreign countries, there is not much aftercare for the delivery. Do they also have such back pain and problems? Definitely. Most of the patients who come here have similar complaints. When they hear that we have such a life practice or routine, it's really surprising for them. They do have many diseases due to the lack of proper care during and after childbirth, and also due to their lifestyle. What are the treatments given for a pregnant woman, and also what all have to be done after delivery as an aftercare? Care of pregnant woman and the embryo is a real important issue. There are several studies that says an increase in mentally challenged, that is retarded children born nowadays in countries like India. It's a very disturbing fact because it affects the formation of a healthy new generation. So, proper care of a pregnant woman is really important. This again brings up the importance of a good lifestyle and healthy food habit for good prenatal care. As I mentioned before, the menstrual cycle can be disturbed due to the lifestyle of a woman. It can later affect the fetus when she becomes pregnant. So if we have a good lifestyle and maintain it during pregnancy, we are more likely to have a healthy child. If we need a child who is mentally, physically, and intellectually healthy, we should give good prenatal care, a proper one. In the first few months of pregnancy, there may be symptoms like vomiting, nausea, loss of appetite, etc. Because of these symptoms, the woman has lack of interest in taking food. Then we should reduce the quantity of food and have it in intervals. They could have it with pickles. They could have food once every 4 hours or like that. They could also consume nutritious food like sprouted grains, that is bean sprouts, pulses, etc. This will make sure that they get enough nutrition, and at the same time they could help avoid nausea and other symptoms. Ma'am, what are the postnatal cares? One should really take care of herself for 1.5 months. Nowadays, women tend to eat meat and other non-vegetarian food immediately after delivery. It is one of the main causes for back pain after delivery. According to Ayurveda, the first 12 days after delivery, one should avoid meat and other non-vegetarian food. For first 3 days, one should eat only kanni or rice porridge or gruel, which is a soft food made with rice boiled in water until water gets thick. Similar to a rice soup, it should be prepared with Panchakarma, a medicinal preparation. Due to delivery, the woman may become so delicate, isn't it, ma'am? Yes, during labor, patient's body is undergoing a tough process, so the body becomes really delicate. There will be lack of appetite during that period. So, one should increase her appetite and digestion with light foods and medicated rice soup with Panchakarma gradually. Once she regains her appetite and the digestion process has resumed to normal levels after 12 days or so, she could be served with meat and other non-vegetarian food or similar heavier food. And will there be other treatments also, ma'am? Yes. One example would be what we call Veda, which is taking bath with medicated hot water with herbs like nalpamaram. Today, Sreekrishna Ayurveda Chikitsa Kendram is a hope for lot many Indians and foreigners. Here, Ayurveda awaits everyone for a great experience. This institution stands for Ayurveda in all its purity and tradition without any compromises. Sri Krishna wants to pave the way for the return of Ayurveda as described in Vedas and wants to prevent the loss of its actual essence. This is the mission of this institution. Doctor, you mentioned about Kaya Chikitsa earlier. What kind of conditions or diseases we treat in this department?
We treat joint diseases. In Ayurveda, there are several types of diseases which affects joints. Here, we are talking about mainly bond joints, where 2 or more bonds meet. Amavata, Vata-Rakta, Sandhivata, etc. Many diseases which affects joints are said in Ayurveda. Similarly, another condition is diabetes. Ayurveda classifies diabetes into 20 types.
Oh my God, 20 types?
Yes, diabetes is classified into 20 different types in Ayurveda. Among this, around 10 types can be completely treated and cured. Then there is another group of conditions known as Vata Rogas. Vata Rogas are diseases which affects locomotion, the movements of the body parts, with pain or without pain, and other neurological conditions. There are 80 types of Vata diseases mentioned in Ayurveda. There are very effective treatments for such conditions in Ayurveda. This is the most fascinating aspect of Ayurveda, that the science has written these things around 3000 to 4000 years back, and we are studying this and practicing this even today. 4000 years back, they had identified 20 types of diabetes. even wrote the specific treatments for them. What amazes me is that we are able to diagnose and treat with all those information written so many years back in the history. The treatments are still very effective. The herbs which they have written in those days are still available and are able to identify them still now. Similarly, there are several types of fevers. Now, it is the era of many fevers. Especially during the rainy season here, there are more fevers. There are specific treatments for different kinds of fevers explained in Ayurveda. 4 years back, there was an epidemic of chikungunya virus or influenza. That was a time when people realized the effectiveness of Ayurveda in Kerala. As chikungunya was a flu, there was not much treatments for it in allopathy or Western medicine. That was a time Ayurveda gave refuge to most of the people here. We were able to treat and cure several cases very effectively. Respiratory diseases, skin diseases also have effective treatments in Ayurveda. Skin diseases is another group of diseases which we are focusing much more. Skin diseases like psoriasis, eczemas, etc. There are almost 40 types of skin diseases classified and explained in Ayurveda, including 18 types of leprosy itself, and their treatments are explained in detail.
This institution is a peaceful mantra for one who decides to lead a healthy life and breathe with ease. We could also become a part of the soul who practices day and night for the fulfillment of the duty to enlighten the lives of others through practicing and living his own self in Ayurveda. Let's also join him in his mission to uphold the values and purity of Ayurveda as mentioned in Vedas, with the skills and knowledge which was gifted by the pureness of a teacher, perfected by the blessings of his Guru. Let this be the perfect Guru Dakshina, a tribute to a great teacher for all his blessings, knowledge and skills.
Om Dyau Shantirandharishang Shanti Pradhavi Shantirapa Shantiroshadhaya Shanti Vanaspadaya Shantireva Shanti Sama Shantiredhi.